For a lot of people, just getting to a doctor's office can be a challenge.
Yeah, so we wanted to dig into what policy experts call social risk factors, which can have a significant impact on people's health. Joining us now is Dr. Bayo Curry-Winchell. She's a physician and health equity advocate. Thank you so much for being with us, doctor.
Yeah, nice to have you here.
Yeah.
Yes.
And notably, right, you just said you were practicing not even 24 hours ago, right? You were with patients and you say this is something you hear from them all the time. Can you just give us an easy definition first? What are some of the social risk factors that come up?
Having proximity to high quality care. Another thing is financial challenges and food deserts, health literacy, and just access to transportation. So you want to go and see the doctor, but if you are really deciding, can I pay my rent or can I get on, actually pay for a medication, it can be challenging.
Right, or if you don't even have a car and then
Right.
you have to take public transportation and you're in Reno where you work, that could be a real challenge. How do these things show up in people's behavior and in their impact on their health, like how they actually are medically?
So a lot of my patients struggle, they want to keep the lights on, but they also need their medication. So it shows up in, oh, I wasn't able to take all of my medication because I needed to pay this bill. And that can be really challenging when you are trying to help that patient get the best care possible, but they also need to be able to have a roof over their head.
So finance is definitely a challenge. Another thing that was listed was proximity to health care. I've reported a lot on maternity care deserts, right? Women who are not close to an OB/GYN provider. I wonder, of the social risk factors, do any stand out to you as particularly difficult?
There's several. When I think about just being able to get to the doctor, but you also want to see a doctor that looks like you, that can understand you, that really is somebody who is diverse, and that is a huge challenge when we talk about maternal health, when we talk about general health. All of those things add up and are barriers to accessing the best care.
What are things that if someone out there is watching and thinking, yeah, I do have some of those issues, right? How can people make changes, or where can they go for help to make changes to try to get access to health care?
Public health is a great option, looking online and finding those resources. The other thing to think about is community hospitals and clinics. They often provide free care or at a sliding scale. So that's the first step to be able to at least get some care and really have the ability to help yourself.
I love that. Scan your community, see what's already out there. Clearly, you're passionate about this, and a lot of this stems from providers themselves. So I wonder, what are we seeing, if anything, in the medical community to sort of address some of these social risk factors?
Really investing in diversity in that healthcare or that community organization, because you need to be able to understand the population that you're seeing. The other thing that is vital is promoting health education that people can understand, that they can actually implement in their lives.
Yeah, I even feel like some of the ways we're talking here, we're talking about social risk factors. That's not the way people speak, right?
No.
So what do you say when a patient says, doctor, I don't know if I can take all my medicine this month? What's your advice?
So the first thing, I lean into curiosity and find out what are the barriers. Because when you bridge the gap and you ask, what are the things that are preventing you,
what's getting in
that's
the
how
way?
you can help people. So I share with my patients, okay, we're gonna find this resource. So therefore you can buy that medication. We're gonna help you get to your appointments. And another thing that I do, if my patient is late, I still see them because I understand that there are other things that might have prevented them from getting there.
That's so good. And it sounds like people should feel empowered to share if they are struggling with something. I can't afford my medicine. I can't make it to the appointment. That's so good.
Yeah.
Yeah. Dr. Bayo Curry-Winchell, always good to have you. Thank you for making the time.
Thank you for having me.
Appreciate it.